So welcome everyone to this lunch and learn about COVID-19 in Lorain County. So we are going to be speaking with Public Health Commissioner Dave Koval with Lorain County Public Health. Before we begin, just a little bit of Zoom etiquette. If you can, please mute yourself just to keep the meeting moving along. And if you have questions, we do have Q&A time at the end. You can also submit questions through the chat box. But again, at the very end of the program, feel free to unmute yourself to just speak or question out loud. You can turn your video off as well, especially if your internet connection might be a little scattered. Sometimes turning off your video saves your bandwidth. So feel free to try that. Also, if you're on a computer, you can move the visuals around. Right now, there's a background slide that says lunch and learn, and then you'll probably see somebody talking off in the corner. So you can move that person around so you can better see the slides. If you're on a phone or tablet, you might have to try sliding things around and different methods to move it. But the background slide will be the most important part of this program. So I'll just get to our text slide. If you do have any technical problems or problems connecting or seeing anything, feel free to contact our Museum Education and Tour Coordinator, Amanda Manahan. You can see her cell phone number there, and she will also be sharing that in the text box, the chat box, I should say. And we do appreciate feedback about our programs, what programs we can be doing in the future, or if you have any suggestions for improving the technical aspects or anything else about our programs. So near the end of the program, we will share a link to an online survey form so you can let us know your feedback. Let me let somebody else in the room here. And then just a few announcements from our organization. The Oberlin Heritage Center is the local historical society of Oberlin. We are open with limited tours right now. Pretty much if you sign up for a tour on Tuesday, Thursday, or Saturday, you get a private tour for everyone's safety and distancing. And then some of our bigger events, we will have trivia night on November 13th. That is also on Zoom, so virtual and safe. So feel free to get a team together. Don't worry if you don't know anything about Oberlin history. These are more like Trivial Pursuit Jeopardy questions. Everyone's got a shot at them. So we're hoping to have some fun on a November night. And then on December 8th, we are having another Zoom program that's in the evening, Tuesday evening, about Elisha Gray. If you've not heard of him, he's an inventor. There's some dispute about whether he invented the telephone instead of Alexander Graham Bell. But this program will be about his research into early electric music. So should be an interesting program, so feel free to join us. And next, I will introduce our speaker today, Dave Koval, Health Commissioner, and also Erin Murphy is joining us from Lorain County Public Health. Let me get my bio right so I get it. So Dave Koval earned a Master of Public Health from The Ohio State University and is a registered sanitarian. Previously, he worked with the Cuyahoga County Board of Health, and today he will be talking with us about what has happened since the very beginning of the pandemic and some current trends and ongoing successes and challenges. And again, there will be time at the end for questions. So I'm going to pass things over, and Mr. Koval, I'll be ready to advance the slides whenever you need.
Okay, well, thanks and welcome. And I'm looking forward to a little bit of the history of pandemic and then also a little bit of this particular pandemic and some questions and answers. So if you want to go to the next slide. So I'm going to do kind of a brief discussion. So I actually guest speak in a class at Oberlin College where I do actually the history of public health and pandemic disease, believe it or not. This is the only year I haven't actually done that because of course it wasn't open in the spring. But I'm going to do an abbreviated version for you because I don't know that we want to go through everything from who John Snow was to, you know, a variety of other things. But so we're going to do just a brief amount about that, and then we'll talk about COVID in terms of when it started back in actually it started in the end of January for us and for Oberlin because of kids coming back to college from Wuhan, China. And then we'll do some questions and answers. Okay, you can go to the next one. So let's talk a little bit about public health. So our main jobs are to promote and protect the health of people and communities where they live, work, and play. And so that's part of who we are. And APHA, the American Public Health Association, has this nice summary of what that looks like. But really, when you think about public health's preventive medicine, right? Public health is this community-based way of looking at disease so that we can stop it before it becomes a situation where you have to go to the doctor, right? And that's really what it's all about. And it's credited with about 25 years of life expectancy in the last 100 years. And so a lot of that has to do with everything from infrastructure like sewer and water to immunizations and vaccine preventable disease and a variety of other things like that. And lately, of course, it's cardiovascular health and other issues and other initiatives that we're working on. So one of the things about public health, though, and one of the reasons maybe why you don't know a lot about what we do outside of a pandemic, is we're the greatest story never told. That's a big line that a lot of public health people use. And the reason is because we only have a limited amount of dollars. And if my choice is to tell you all the great stuff we do, or to spend money doing that, or to just get the job done, frankly, that's what we do. We just get the job done. And so unfortunately, sometimes those efforts are not seen because we prevent disease. And when you prevent the disease, you really don't see the output all the time. So anyway, so that's one of the reasons why a lot of people don't know as much about what public health is really all about. Okay, you can go to the next one. So let's talk quickly about the history of public health in a kind of a crash course kind of way. Now, this is usually like 10 slides of pictures of older looking gentlemen who have created public health over all these years, but we're going to try to do it in one timeline. So if you think all the way back to 312 BC and the Roman aqueducts, Romans really didn't have any idea what germ theory was, but they knew that if they drank the water at the same area where the restrooms, released into the river, that they'd have a problem. So what they did is they created an aqueduct that would bring water from the mountains into Rome. And so that way they could drink fresh water and it wasn't polluted. Now, they didn't know exactly why people were getting sick. And again, that came a lot later, but it was kind of the early introduction of some of these practices. Now, there's also other practices discussed in the Bible and discussed in old literature that talks all about, washing your hands and a variety of other things. But the Roman aqueducts are really an infrastructure thing that happened a long, long time ago, where they kind of figured it out, but they didn't know exactly why. So in 1799, we fast forward way ahead to 1799, and the first Board of Health was created in the US. And believe it or not, Paul Revere was one of the first public health officials, and it was in Boston. And he was one of the first board members for a little trivia there for you, maybe for trivia night. You could use it for trivia night. In the 1800s is when really germ theory came. And that was really an important piece. And prior to germ theory, there was all kinds of things that were going on. There was bad air. There was all kinds of things. And I'm going to talk a little bit about junk science here and a little bit about a variety of this part. But really, it wasn't until the 1800s when people really started to understand what germ theory really was. And as a matter of fact, infant mortality rates were extremely high. And it was in England where they found that one of the docs figured out that they were actually they had a morgue down on one side of the hospital, and they had a birthing center right near it, and people would work on the dead bodies, and then they would come back and give birth and help women give birth, and they were having 4 out of 5 women were having stillbirths. And then they began to wash their hands in between those two processes, and it dropped to 1 out of 5 with having a stillbirth. So again, when you start looking at that, and again, they weren't sure exactly what that meant. They knew washing your hands did something, but they weren't exactly sure. And then germ theory started to come around to really kind of figure this out. And then a very famous one was John Snow and a cholera outbreak that happened in 1854 in England, where cholera was in a certain area of London, and he mapped out all the houses that were affected by cholera and found out that the Broad Street pump was the one location that they were all getting their water from. And believe it or not, the solution was they took the handle off the pump. And people started going to other areas and other wells in the city to get the water, and the cholera outbreak went away. And so that's kind of the beginning of epidemiology and the understanding of how disease moves and what affects disease. And so anyway, so that's kind of a famous piece of the puzzle. And again, if you want to go to Oberlin College, you can see more of my full presentation on all of this. Okay, so now let's get more modern, right? In 1918, the Spanish flu. Now, I used to talk about this in class and the Spanish flu, and all the kids would look at me like, what's that? But now that the pandemic has hit, they realized that the Spanish flu was the last pandemic, and that really was the large one in our country and across the world, and wiped out quite a few people. And one of the big differences between Spanish flu and COVID-19 that we're dealing with now is Spanish flu actually affected people with very healthy immune systems. What would happen is that it would infect you and your immune system would produce so much that you would drown in your own liquids. And so what really scared people was people were coming back from the war, and they were in good shape. They made it through the war, and yet they were dying at home in the Spanish flu because, again, they had these really strong immune systems, and a lot of 20-something people were dying from that. So, and at that point in 1919, here in Ohio, the Hughes-Griswold Act was passed that created local health departments. And what they wanted to do is create a health commissioner and a nurse and a sanitarian in every single community in our state, so that in case there was something like this would happen again, there'd be some infrastructure that could actually make these decisions and really help with the pandemic. And that structure still exists to some degree today. So then in the 1960s, more modern public health came along, and we really started looking at chronic disease. There was quite a bit of environmental work, regarding water and sewer and solid waste and some other things like that. And then I'm going to talk a little bit today about, what happened at the beginning of the COVID-19 outbreak here in 2020. So that's as quick as I could do on a crash course in public health. So let's go to the next slide. All right, let's talk about COVID-19. You can go to the next one. So epidemiology, you may hear people talk about these EPIs that are doing case contact tracing. And so what is epidemiology? It's the branch of medicine that deals with the incidence, distribution, and possible control of diseases and other factors relating to health. Basically, we're tracking disease in the community, and we're identifying outbreaks and how they occur, and then we're preventing them. And so for every day prior to the pandemic, if there was a case of salmonella and then it was reported in our community, one of my nurses would call you at home and say, hey, we were diagnosed with salmonella. I want to talk a little bit about the incubation period of this disease and what your possible exposures might be. Was it a restaurant? Was it a grocery store? Do you have a salamander at home? Because they can give salmonella. So again, we kind of did that, and that was going on all the time, and it still goes on all the time. And then of course COVID hit, and so that same team got beefed up to actually do the same thing with this communicable disease. Okay, let's go to the next one. So let's talk just a little bit about the virus itself. Okay, and I want to talk about something called shift and drift. So viruses like SARS and MERS are similar to COVID-19, and they're a little different than seasonal flu. So when you think about seasonal flu, it's a virus that mutates a little bit every year. So it moves from our hemisphere down to the southern hemisphere in Australia and that area, and then it slowly mutates a little bit and mutates, and then it comes back up here again. And about 6 months out, we try to guess, based on what's going on in Australia, what the best strains of flu vaccine would be to combat seasonal flu when it gets here, because we know we're going to estimate that a little bit. And so as that happens, they target in what's called quadrivalent vaccine 4 different strains, and they put it into the seasonal flu, and they guess at what those strains would be once they get here. Now, as long as it doesn't mutate too much between the time they start making the vaccine to the time it gets here, it matches pretty well. And that's when you hear that the flu vaccine's working really well this year. Other times it continues to mutate a little bit, and so the flu vaccine doesn't work as well. And because it's not quite as much of a match, because it mutated a little bit more while we were making. And again, it takes some time to make the vaccine, so you really got to guess about 6 months out on what exactly it's going to look like based on what's going on in the southern hemisphere. So that's called drift. That's where the virus drifts and it mutates just slightly and it goes into animals and humans and back to animals and humans, and that's called drift. A shift is when a virus jumps directly from an animal species directly to us. And what happens is your T cells, your immune system, can't recognize it. And so the problem you have, if it happens to shift quickly and it's a deadly virus, then your body may not get the chance to make that, to be able to identify it before it kills you. So again, at the beginning of all this, when it was happening in Wuhan, China, we were concerned about two things. How contagious is this disease and how deadly is the disease? And so there was a lot of discussion around that piece. And so in the fall of 2019, when this was all happening in Wuhan, the WHO and CDC were looking at this as a potential pandemic. At that time, they always start with, it could be really, really contagious, and it could be really, really infectious, okay? And so an example of a virus that's really infectious is Ebola, right? Ebola is extremely deadly, but it's not very contagious. Seasonal flu is very contagious, less deadly, right? And so the question was, where did this land? And so that was really the big debate back in those times. Now we found out that it's very contagious, much like the flu and even more so. And it's not as deadly as something like Ebola, but it's a little more deadly than the flu. And so it really can have a bad impact on us. And so that's where it ended up landing. So in January of 2020, I got a call from Oberlin College. As this was going on, they said, hey, we've got a bunch of kids in Wuhan, China that are students here and they'll be coming back soon. What do we do? And so all of this started for me a little bit earlier than it did for many of you, because we had to start identifying how to isolate and quarantine folks that were maybe coming back from this region of the world. And if you remember when this first started, it was really about travel. We tried to restrict travel a little bit so that the virus wouldn't get here. Well, it turns out the virus was already here by the time those travel restrictions started, that we had already had people moving that virus into our community. So in mid-March was when really community spread hit very hard here in Lorain County and around Ohio, not quite as hard as it was hitting in New York and even in Michigan. And so when the shutdown happened, it happened just about at the right time to make sure that we didn't get overrun like New York City did. And it was really all about slow the virus down so that the hospitals are more ready in case we get, in case there's a surge in cases. And we did a very good job here in Ohio. And since then, it's been keep that curve as sloped as possible until we can get a vaccine here. And that's really what we're up to now, is really we need to keep, people will still you can't stop this virus, it's too contagious for that, but how can we slow it down so that we don't overwhelm any of our hospitals as we're waiting for the virus or for the vaccine. And so that's really what the condition or the situation we're in today. So I want to talk a little bit about statistics. Actually, in a few hours, you're going to hear that we're going to go red as a county. And so I'm going to talk about some of those statistics here in a minute. But I'm going to talk about what those are all about and what that means. And then I want to talk also about the vaccine. So it's really the light at the end of the tunnel. We're all getting really frustrated and really it's a marathon, not a sprint, as Amy Acton said all those months ago. And that's a long marathon, and we're all having some fatigue and kind of lonely and sick and tired of wearing a mask kind of thing. So again, the vaccine's the light at that end of the tunnel, and I'm going to talk a little bit more about that in a little bit. Okay, let's go to the next one. All right, so here is what it looked like over time here in Lorain County. So you can see at the beginning, we started in a very steep uphill climb. And then in March, everything shut down and it flattened everything out. And then as we started to open again in May and June, we opened slowly, and then slowly we got more and more open. And then you could see there in June and July, look at our case count. So conveniently, this is right around the same time college students were showing up and 20-somethings were starting to be tested more. And so we had a huge increase in cases during that time frame, because again, a lot of 20-somethings who have mild symptoms usually, they were kind of throwing the caution to the wind, if you will. So that was a lot of what we were seeing at that time. And then it started to dip again. And right now we happen to be in a little bit of a wave also. And again, so far it has not hit our schools, and they've been doing a great job. And there's some other things I want to talk about around that. But you can see we are starting to increase a little bit, and we will continue to increase, I think, for a little bit longer, for a couple more weeks. Okay, let's go to the next one. This is a recovery graph. Now, not that many local health departments really have this, but our EPIs decided that they really thought this was an important graph to have, so that people understood what the situation is, right? We've got a lot of cumulative case count that people seem to be infatuated with, but really cumulative case count isn't nearly as important as that 7-day rolling average you saw on the last slide. Could be because cumulative case count, when you look at it, is the total number here. But in the green is all the people who have already recovered, right? And so that's important to remember, so that you know what the active case count is, because that's what really matters. And that's, again, the blue section where people have not recovered yet, but they have also they have active virus. And then the total deaths, which is obviously small, is in red. And so that's kind of where we are right now. And at the very, very tip, you see brand new cases. So those are people that they come in every day. That's every single day we get more. And so those are that's an important graph to look at. It probably doesn't look that exciting, but honestly, it's more meaningful than many of the other graphs that we have on our website. Okay, go ahead. Okay, so let's look at the age piece. And so for a long time, this graph was slanted towards older adults, and that's because only older adults or people who are working in the medical community could get tested. And so, or if you had an underlying health condition, but that was really it. And then when testing opened up to everybody, that's when you start to see this community spread, and you see the 19 to 30-year-olds have now taken over as the most people who have this, and the most people who are spreading it, frankly. Okay, let's go to the next one. So here you can see the age adjusted based on death. Now, the most important piece to this is the yellow part. So most of our deaths have occurred in long-term care facilities. They are older adults that were in those facilities, and then the virus started to spread, and they were our most vulnerable population. If you look at the average age, if it's not in a long-term care, then really that average age is more like in the 70s that we really run into folks who are dying outside of a long-term care facility. And so I know everyone talks about it's really 85-year-olds and older, but to be honest, outside of the long-term care, it's really that 71 to 80 category that's really has risk. And so again, I think that's an important distinction, because if you look at just the total number, you would automatically say, well, it's people who are 81 and over, when really most of those were in nursing homes. And so it was really for the community spread piece, it's really in the 70 to 80 category. Go ahead. And then here is the racial breakdown when it comes to how we're doing here in Lorain County. Now, we've talked a lot of people have talked about the impact on African-American community and other minority communities. And that certainly is the case for us. In case you don't know, our African-American population in Lorain County is about 10%. And you can see here it's about 12%. So it's certainly higher than what the population is. And then the adverse effects associated with that are also an important thing to remember, because we've talked quite a bit about race and its effect on individuals' social determinants of health and these other health-related issues that cause a concern for us as public health. One of it is because if you have an underlying health condition like diabetes or another COPD or another health-related issue around your heart, it can really be a problem for COVID, and you end up really with a bad situation. And so over time, what we found is because of health equity issues, people have not addressed these issues as properly as they should. And so now this is really glowing because of COVID-19, because these underlying health conditions have never really been addressed properly. And again, a lot of that has to do with access to care and insurance and a variety of other problems in our healthcare system. So, okay, let's go to the next one. Okay, and then ethnicity is the same thing. And here you can see the Hispanic number is again 16%, and I believe we're 13% as a county. And so, when you start looking at that, it is higher than it is. One of the things I wanted to point out was in areas like New York City, they found this number to be huge in terms of African American populations. We've had less of an impact, an adverse impact, if you will, in Lorain County than we have than maybe in New York City, but there is still that impact that's disproportionately among populations of color. So if you want to move to the next one. All right, so on our website all the time, and these are just the most recent ones, that's probably going to be updated in a few minutes, so it'll probably change a little. You can see the confirmed cases and probable cases. And when I talk about probable cases, those are people that we have quarantined and then began to show symptoms. Now, they didn't end up going to get tested, but they're probable cases. The other way a probable case happens is if someone gets an antigen test. Now, we're going to talk about antigen tests right now. If you're going to ever go get tested, please get a PCR. Walk-in clinics that offer antigen tests have a lot of false positives and a lot of false negatives. And so it becomes a problem for us, and it also doesn't give you the best information. Now, yes, it's quicker, and we in America, we love quick, right? But again, think about it as soup. If you have instant soup, it's quick, but it's not that great. But if you have homemade soup, it's a lot better, right? Let's think about that in the same way when you think of testing. Again, this idea of getting a quick test because it's more rapid isn't necessarily helping all that much. An example of that would be the governor. You remember when the governor was going to meet with the president, he got a positive antigen test. They went back and followed up with a PCR and found out that it was a false positive. And so we've had quite a few false positives and false negatives when it comes to the antigen tests. And so I don't recommend those. They're good in some situations, but not if you just want to go get tested to find out if you have COVID-19. Go for the PCR test. Okay, so that leads us with our total. And you can see there's our total number of recovered. That's 2,142. So you can see a large percentage are recovered. Our age range is pretty much the same as the rest of the country. We have 82 deaths so far here in Lorain County. And we have 5,000 total contacts that were quarantined since the beginning. 3,630 have been released. Okay, and then there's about 800 right now all around Lorain County that are being actively monitored to make sure that their symptoms are okay and they're quarantined. And those folks hopefully will all recover after their 14 days, and they'll be okay, and they will have never gotten it. That's the plan. And you can see 3,630. That's exactly what happened. They were quarantined but never got it. Okay, let's move to the next one. This is something else that we handle, and we're going to do a little bit of this when we do Q&A. We handle a lot of calls, right? We have a team of nurses that handles calls. We have a team of sanitarians that handles calls. So if it's a medical question, a nurse will give you that answer. And if it's an enforcement question, like aren't these people supposed to be wearing a mask, or this business isn't doing what they're supposed to be doing, or whatever, again, we take all those. Now you could see where the peak was. That was back in March. Everybody was concerned. They didn't know what the answers were, and so we had huge phone banks of people answering these calls. Since then, we've had little blips here and there when the orders change or when testing changes or things like that. But that's another thing that we're doing behind the scenes. Okay, move to the next one. Okay, so if you didn't listen to anything else about data around other than the antigen test, if you didn't listen to anything else, listen to this part. So this is the system and where you are rated as orange, yellow, orange, or red. Or purple if it gets that far. And so right here, we're currently orange, but in a few minutes, we're going to turn red. So, but you can see this is the sheet that I suggest all of you, whenever you're looking at what does it mean to be orange, what does it mean to be yellow, what does it mean to be red, this is a sheet that you can click on our website, and it pulls up why we are rated to where we are. You could see these indicators. One indicator number one, is if you have 50 cases per 100,000 people, then you click that indicator. We're at 40. We were at 49, and we just had a little more than that. So now we're going to get up over 50. We'll probably be closer to 60 per 100,000 people. So we're going to click that one, which is what's going to make us go red. If you look at indicator number two, that is new cases increase every day. Well, you can see that's starting to come down again. Okay, so in about 2 weeks, that we're probably going to count. We're no longer going to hit that indicator anymore. And then if you look at indicator number three, that's how many are coming from hospital or from long-term care facilities or prisons or things like that. And then number 4 is ED visits. That's emergency department visits. And you can see that's been pretty flat. That hasn't really, it's gone up a little here and there, but it's pretty flat. And then the other one, the indicator 5, is outpatient visits. And you can see how that yellow section where we went up, we had quite a bit of outpatient visits where people were concerned, they went to their doctor. Well, all that's tracked to find out if it's an indicator that we could have a problem with our hospitals over time. So all of those indicators are the ones that usually tip us from either orange or red or sometimes yellow. Okay, and those are the 5 indicators that we've mostly tripped whenever we do change a color. The 2 last ones are the ones I really want to make sure are clear. Hospital admissions, okay, that's people who are actually in a hospital bed, we're not met. And if you look, our hospital admissions per day on a 7-day average are always between 0 and 1. Okay, so we have not really had a problem in this. They've been pretty good the whole time. And the indicator 7 is how many ICU beds we have, and we have plenty. There's really no problem with ICU beds. So in other words, the really important data, the hospital data, has all been flat, and we're doing pretty well. Why does that matter? Why do we care about the case count then? Well, because no one knows exactly how many cases it takes to start flipping the hospital data, right? So that's why you start hearing them talk a little bit about hospitalizations are starting to go up, because there's a concern that we could overwhelm ourselves in our hospital system if they go up too fast. So again, so far in Lorain County, we really haven't had that problem, and we have so many great facilities in terms of UH and the clinic and Mercy that we really have we're blessed with a lot of really good opportunity to have a healthcare scenario that is not going to get overrun. So we're doing well here in Lorain County. Some of the more rural counties, they struggle with that because they may only have 1 hospital in the whole county, or they may have 1 for 3 counties. And again, that's when those concerns really start to be a big concern. Okay, so remember, when we turn colors, click on the button and it'll give you all of this indicator, and you can watch it over time so that you're not alarmed every time we change a color. You can see the trend. Okay, let's go to the next one. So this is what I want to talk about because it's really important. And let's face it, there's an election going on, I guess. So we get a lot of junk out there. So I want to talk about junk science. About 2 years ago, I was at a council meeting and they asked me, what's the #1 threat to public health? And I said, junk science. People thought I was going to say either opioids, which is clearly an issue, or maybe a future pandemic. But really, it was junk science. And when we have a pandemic, when we have some major thing, we've got to fight through the lies out there before we get to the science. And that's been a problem since this pandemic started. And I'm not sure how we're going to fix it. So there is an issue out there. And so I want to say that, hey, this isn't the first time. There's been junk science out there for a long time. So here's some examples. For hundreds of years, the earth was flat, right? We all know that. The tobacco industry said for many, many times that we were overreacting. Tobacco is really not that bad for you. And it turned out, of course, that is. Immunizations and autism. So back in 2010, the Lancet recanted because they had published an article where a doctor had looked at a link between autism and vaccine. Now, it's not a bad thing to research. Matter of fact, it's a very good thing to research because autism symptoms start around the same time that a baby's getting their first rounds of vaccine. And so that's why parents were saying, well, my child was fine. All of a sudden I got that vaccine, and that's about when my child's symptoms started. Well, yeah, there's a correlation there of timing. But what they had done is they hired a doctor to do a study. An insurance company hired a doctor to do a study, and the attorney was suing regarding this vaccine company over it. And so, unfortunately, what a lot of people didn't read was the study only had 12 participants. Since then, it's been that study has been redone 30 times or more, and it's every single time it's been shown that immunizations do not cause autism, and yet it's still out on the internet, and Jenny McCarthy still says it's true, so it must be. And so that's really a problem that we run into. And so now it's called fake news, right? But this has been out there for a long, long time. And it's important for everyone to remember the scientific method is the key. You always try to do some research, and then you reprove it and reprove it and reprove it again. And unfortunately, we get the initial research and it gets all over the headlines, and people automatically think that this new thing is true when we haven't proven it yet. So again, that's an important thing. And it's also important to remember, don't post that on social media. There are so many terrible things out there right now on social media that just aren't true. So please, before you repost something, take a minute, make sure, call me if you really need to, and I'd be happy to talk through it if it has to do with COVID. There is a book, there is an article basically that talks about this called Manufacturing Uncertainty. So if you want to look at that, you can. It's a really great discussion about this issue. There's also lots of discussion about how our phone, this artificial intelligence that makes you touch your phone, makes money for companies, but it also promotes a lot of bad information out there. And so there's lots of discussion around that, but I don't want to go too far in it. And I'll now get off my soapbox and stop preaching to you about the fact that social media is evil. And instead, I just want to remind you that if you hear it on the internet, it doesn't necessarily make it true. All right, let's go to the next one. So let's talk about when will it all end? And I know we're going to have some discussion around this in the Q&A, but so first, as with this virus, I've been humbled many times. It's hard to tell exactly what's going to happen next. But right now, there are two main vaccine producers, Moderna and Pfizer, that are rolling along and have already got a vaccine that they think you're going to find out in the next week or so that is very effective. They still have to do the safety pieces of it. They've done some of the safety pieces, but they still continue to do that, and they will all the way through November. And then most likely, sometime in December, there's going to be some discussion of whether these two and maybe some other ones are going to be ready for deployment, if you will, or mass production. You're going to hear a lot about this, and there's going to be a lot of discussion, hopefully after the election, so that we can cut through the noise and really get to the meat of this. But I think sometime between December 1st and the end of March, you're going to see the shining stars, if you will, the vaccine that really is effective and safe, and it's going to start moving into the community. Now, Pfizer claims that they can produce 1 billion of these, a billion of the vaccine, of 1 billion doses by April. That's pretty optimistic, but I mean, they say they have the production to do it if it does get approved. So again, if that happens, then you're talking about the spring. So we're really looking at November, December, January, February, and March. Boy, those are the roughest months to have a vaccine or have an outbreak of COVID, right? And so again, getting through there, at least there's some light at the end of the tunnel. Now, how long will it take us to actually vaccinate enough people? That's a whole nother discussion, which is why people say, well, it could be all the way to the summer, it could be longer. So again, but that's the current update on the vaccine. And if all goes well, I think we will see at least the first 1, 2, 3, or 4 vaccines will be decided upon in December and January. Okay. In the meantime, we need to live with the virus and lower our risk as best we can, right? And so we've got this on our website too. It's a reduce your risk kind of chart. We copied it off the CDC a little bit. We kind of stole that. But it talks about what's more dangerous and what's less. And obviously outdoor picnics are less dangerous. But once you start thinking about Thanksgiving dinner, how are you gonna have Thanksgiving dinner without it being increasing your risk? And so we'll continue to give these kind of guidance documents on this is what we think is the lowest risk, and this is the highest risk, and somewhere in between. And every person for themselves are going to need to make some decisions on how much risk are you willing to have. And more importantly, how can we find a way to do things less risky so we don't get more spread of the virus? And that's going to be a really, really important thing over the next few months. Okay. Let's go to the next one. All right. So I want to open it up for questions. I know I gave you a ton of information, and you're probably thinking, holy cow, maybe I should have him and Fauci in the same room and we could just debate it all day long. So I don't have all the answers, but I'm willing to give you all the ones I have.
So if you'd like to ask a question, feel free to put it into the chat box or unmute yourself. And also, I know some of you may have to leave early, so we will get you that feedback form link in the chat box and also email it to you later. And Mr. Koval, thank you for allowing us to record this as well so we can share it with other people. But please, if you have a question, ask it now.
I don't have a question, but I just wanted to say thank you. This was very informational.
Yeah, no problem.
Mr. Koval, there was a question from Anna. Will Lorain County be releasing data by zip code?
Yeah, I still can't figure out the infatuation with that. So we do have community-based data already on our website. It has the same kind of data that we looked at, some of the charts that we looked at by community. A cumulative case count by zip code, to be perfectly honest, doesn't really tell you anything about how the virus is spreading, but timelines like you saw me show for the whole county, we have those for all the communities. And so you can see how the virus has spread over time. But again, it's not zip code based, it's really in the community. And one of the other problems with going down to the zip code is frankly, we just don't have enough cases to really show anything meaningful. So what we did is we said, well, let's just make a cutoff of about 20 cases. If you've had 20 cases since the beginning. Of course, my epidemiology person said, hey, you know, it should really be 50. We should, but you know, honestly, we just don't have that many communities with more than 50. So we knocked it down to 20. So you can take a look at all the different communities and see how they match up with the county as a whole. And it'll really tell you a story too of where testing was mostly available, right? Because remember early on, there was more testing in Cleveland and less testing in Lorain County. So if you lived closer to Cleveland, you had more access to testing. If you were a medical professional, you had more access to testing. So anyways, there's a lot of factors there. And again, I understand people are interested in the zip code, but I have a lot of friends in Cuyahoga County and they still are confused by, is it safer to live in Westlake than it is in South Euclid? And the answer to that is absolutely not. Just because they have a total accumulative case count higher does not make it more dangerous to live in South Euclid. So again, so that's what we put on our website to really give people the better information that really is more robust. So that's on our website, on our data page. Go about halfway down, you'll see click here for community-based data.
We have another question from Angela Bach. To what extent are we seeing spread in faith communities of Lorain County? Is there data on what safety measures churches are taking and how effective they are?
Yeah, so we've only had a couple of issues around faith-based communities, and they were all outside the church. So in other words, they weren't actually, the churches are doing a good job when they are having in-person service of keeping separate and again, wearing masks. And again, choirs, not such a good idea right now because again, you push out the virus a little more. So anyway, so I actually just had a meeting with the Pastors Association just earlier today. And so I update them regularly on some different thought processes, and they're concerned because again, Christmas is coming and that's a big season in the church, obviously. As far as the outbreaks that we've had around them, it's been, unfortunately, parishioners going back to someone's house and having a barbecue, and that's where a spread event happened. And so we've had a couple of those, but as far as inside the church, we haven't had any. I would say that's the same with schools, to be honest. Schools have done a really nice job, and we've gotten some cases in schools, but once they come in from the outside, they just don't spread because they have kids spread out really well, and they're doing a great job so far. Hopefully it'll continue that way. The one times that we've had a few has been outside of school. In other words, not even football practice or something like that, but kids hanging out, because frankly, how do you control high school kids from hanging out? So that's really been where we've seen some spread there.
Be coming up with questions. Just wanted to let you know a few people in the chat box have thanked you for the program. And Amanda has shared information about, shared your website as well. Other people have questions you can ask. I might ask, whenever you're in a situation like this, looking back, do you wish your department had done something different early on?
Yeah, every day. So we do a lot of continuous quality improvement. We just met with the Epi team because with the high case count that we're going through now, we're also having a lot of contacts per case, which is really stressful on all of our people that are actively monitoring people. And so we never developed a completely electronic way to do it because it just kept expanding so fast. And so now we're looking back now and saying, well, should we think about putting it together just even for the last 5 months of this or however long it might go from here. And so anyway, so we're having to do some of that reinvention and so that, there's always some of that. I would say this, people are always talking about data and how the state of Ohio is not sharing data as much as they should. Well, I got to tell you, the data team at the Ohio Department of Health is 5 people, 5. The infrastructure around Ohio in public health has been decimated over the last 30 years. And unfortunately, local health departments have still been pretty good, pretty solid, but But really, at the state level, they just cut at the budget consistently. And so that a lot of times you're not getting the data, but it's not because they're trying to hide it from you. It's just because they don't have enough people to produce all the data. And so that's really one of the issues you should consider, if you're thinking about, why aren't we getting this out? So.
Okay, Dave, can you hear me?
I can hear you, Judy.
Okay, I just had a question about travel. Are there restrictions, or is it safe to travel?
Yeah.
What's any information on that?
Yeah, so a couple things. First, when you see a travel advisory, it's because the percent positive for that state is 15% or higher. That's when you get a travel advisory for that state. And that fluctuates, and you can go to ODH's website and they'll show you the fluctuation of that. As a comparison, Ohio's percent positive is around 5%. Right. And so our percent positive is a lot less. And so that's a really important number and a really important thing to be thinking about. So if you're going to travel to one of those states, you're probably going to be asked to be quarantined when you come back. But more importantly, you do increase your risk a little bit because it means that virus is actively spreading currently in that state. Now that does change, and Florida was like that for a while, and they are now below that. And so other areas. So just go to ODH's website, and you should be able to get into the travel part, and they'll show you that. And CDC monitors that on a regular basis. This brings up Thanksgiving. Again, when I think about risk in Thanksgiving, right, staying home, okay, just you and your immediate family is low risk, right? Maybe having one other family come over, that's it, your son, daughter, brother, sister, whatever, in their group, and having separate tables, but still being able to see each other and that kind of thing. A little more moderate risk. Having 12 different family groups all come from different states and all show up at one place and have one big party is a really high risk thing, right? So that's when you think about travel, think about where you're going. And if you're going to a beach and just hanging out by yourselves and your family, you're probably a lot safer than if you're going and, Judy, maybe you want to go to Florida to one of those beach parties, but you probably shouldn't do that this year. So.
What about, is it safe to fly?
Yeah, so remember, the virus probably will not spread through the recirculation system in a plane. It's really about the person sitting next to you, right? And in front of you and behind you, right? And so again, the planes are doing a good job of trying to keep that safe. So they're making everybody wear a mask, and they have hand sanitizer, and they have, cleaning your hands regularly is an important piece. And so, are they safe? It's more of a risk than not flying, of course, and more of a risk than driving. However, in terms of the virus, but they're doing a pretty decent job. So I couldn't say that it's the highest risk thing, but it is higher on the risk scale, if you will.
Okay, thank you.
All right. Well, thank you so much for your time today, to you and Erin for setting this up and agreeing to do this with the Heritage Center for free. We really appreciate that. And thank you all the participants for coming and asking questions and spreading, I think, very valuable information to everyone you know. So I applaud you and thank you so much for being with us today.
Okay.
Thank you.
Hang in there.
Thanks, Dave.